Hi there, this is Dr. John from the Florida Center for Hormones and Wellness. And I want to talk a little bit about hair, particularly in women. So it's a common myth out there that testosterone itself will lead to hair loss in women. And I will say that in a very limited number of women that may be the case. That is, women that are particularly heavy converters of dihydrotestosterone and may be subject to the genetic influences of pattern baldness in their family. In a very limited number of people, that may be the case. But overwhelmingly, hair loss in women when they're in their menopausal years is directly related to either thyroid, nutrient deficiencies, or iron. And when we see hair loss in women, we want to pursue those avenues of investigation and, in fact, treatment to see if we can resolve that issue. So let me explain briefly what happens. So when women will be starting to notice some hair loss, and I'll never forget the day. Remember when I was a young child and my mom went through this. It was really frightening and terrifying, and she used to sit in the bathroom for hours crying and anguishing over her hair loss. And I never really understood the impact of it until I began doing this wellness type of medicine. And every single day, just about in my office, I see a woman who complains about hair loss. And it happens normally at menopause, but what happens is all of the hormones and all of the nutrients start to get mixed up, they start to get deficient, and our body gets to a normal state of what we call homeostasis. And homeostasis means a kind of a balance. And so even though women are losing hair at a slightly higher rate than they were younger, they've accommodated for the iron deficiencies, the nutrient deficiencies, the thyroid deficiencies, and all of the other hormonal imbalances to lose hair at a specific rate. And sometimes when we introduce testosterone, it disrupts that homeostasis and it brings out the underlying defects a little bit more prominently. And what I see is that primarily when we restore thyroid, that's right, thyroid, to an optimum level for a particular individual, most of the time that hair loss will resolve. That is, we have to get that thyroid to a level that may even be just slightly outside of the range on the higher end to stabilize that hair loss. But when we go beyond the thyroid and we still see hair loss, we can see things like iron deficiency, particularly ferritin. Way too often women will lose iron and are iron deficient throughout their life, and it's manifested by a loss of a carrying protein called ferritin. And what we try to do is increase that by giving some iron supplements. So when we increase the thyroid to an optimum level for women, when we improve the ferritin levels, we'll also see a big improvement. A third thing that can be done to minimize or reduce hair loss, and in fact even reverse it, is to supply the proper nutrients that support hair growth. And in this office we have several very, very good supplements that we use that actually I can tell that are popular because they get refilled all the time. That is, if the women are refilling these things, that means that they're working. And it's called, I have a couple of those we can talk about, and they're very effective at restoring the nutrients that are necessary to support hair growth. So really when I see hair deficiency in women or hair droppage in women, if I get the thyroid balanced, if I get the ferritin levels up, if I get the micronutrients balanced, and if I get a really good organic chemical-free shampoo and teach women how to properly shampoo, we can eliminate most of that hair problem. Now, there are a few instances, and I will tell you, it is actually very limited, that may be directly related to the testosterone. In those instances, sometimes we can use a medication called spironolactone. Spironolactone is an old-fashioned blood pressure pill. It's not used very much anymore. It was used for blood pressure, for fluid retention, and for heart disease. But one of the great benefits of this medication in the wellness community is that it blocks the effect of testosterone on the skin and the hair. That is, you can use the spironolactone to block the effects of the testosterone causing either acne or hair loss, and it works wonderfully. So when it comes to hair loss in women in the hormone replacement community, there's a lot that can be done. And it's really kind of a myth that it's only related to the testosterone because there's a wide variety of other things that do disrupt the hair growth and do possibly lead to an acceleration of hair growth when we're instituting treatment. But I can tell you that most of the time it's readily treatable and readily reversible. So this is Dr. John from the Florida Center for Hormones and Wellness with a brief discussion about hair loss in women who are on hormone therapy.